Selamat siang semuanya, saya Ira dari Lavender Medicare. Hari ini saya bersama Dr Pang Yoke Teen di Mount Elizabeth Orchard. So Dr Pang, what are sinuses?
Sinuses are actually four pairs of air-filled space inside our skull. Sinuses are actually interconnected, linking to each other and to the nose itself. Normally, these sinuses are filled with air. Air is on X-rays is actually black in color. As you can see, on this image here, they are completely black. So this is a normal scan of the sinus. And as we move further back, you can see sinuses between the two eyes. These are the ethmoidal sinuses, and these are the frontal sinuses on the forehead. So let me take you through what a CT scan of an abnormal or chronic sinusitis looks like. So if you look at this scan here, this is a cheek sinuses that we mentioned earlier. Instead of it being black and completely filled with air, you can see that the right sinus here is opaque, what we call whiteout. So it's filled with mucus and stuff. And you can follow this through the different cards of the scans. So this is actually evidence of sinusitis.
What are the common symptoms that patients will complain of when they have sinusitis?
Sinusitis is actually inflammation or infection of the lining of the sinuses. So basically the lining of the sinuses becomes swollen and they can actually block the outflow of the sinuses. And over time, this accumulate fluid inside the sinuses and that can become infected and becomes what we call sinusitis. Typically, sinusitis starts off with a common flu or cold or an allergy symptoms that seems to last longer than the usual. So, common complaint will be blocked nose, thick mucus coming up from the front end of the nose, or they may have what we call a post-nasal drip that goes to the back end of the nose and goes down into the throat, and patient will then cough that out as phlegm. And this phlegm tends to be very thick, sticky, could be green, could be yellow in color, but typically much thicker than a usual runny nose. Sometimes they will be able to have symptoms of pressure in the face or headaches. And some of them in severe cases may even have fever. Sometimes patients also complain of ear pain, sore throat, and also a very severe cough that is very persistent, especially worse at night when they lie down.
What are the types of sinusitis?
Sinusitis can be divided into two main categories: the acute sinusitis and the chronic sinusitis. The difference is actually time frame. So acute sinusitis is any symptoms or sinus infection that's lasting less than 3 months. We call it acute sinusitis. Chronic sinusitis is anything more than 3 months. Acute sinusitis, the symptoms tend to be more severe. So you'll present with very blocked nose, stuffy nose, coughing, fever, very unwell. And this persists for a long time, usually more than 10 days. Chronic sinusitis, on the other hand, have most of the symptoms of acute sinusitis, but the symptoms are less severe. So fever may not be present, but they can still have a cough, but the cough is not as bad as what an acute sinusitis is. But the symptoms last much longer.
Is there a trigger for sinusitis?
Always start off with a flu or cold. The other common triggers are allergies. So people with allergic rhinitis, so they have sensitive nose, and if that is not dealt with or not treated, over time that can actually progress on to developing a sinus infection and therefore sinusitis.
Can you share with us about the treatment plan for sinusitis?
So the typical treatment for acute sinusitis would be one, an antibiotic. At the same time, we will give them some mucolytic, which means to thin down the mucus, and then we will encourage them to wash and flush their nose to clear out all the debris, the mucus, all the things that are jamming up the sinuses. At the same time, we also can give them some decongestant to open up the sinus airway. Typically, if this is successful, the sinus infection will settle down and go away. In chronic sinusitis, these individuals usually are not so symptomatic, but they have symptoms all the time. They wake up with some phlegm in the morning, they have some blocked nose that is regularly there, they blow their nose in the morning, it's thick yellow stuff, then after that they seem to be quite well for the rest of the day, only to have this repeated on a daily basis. We may need to look at more interventive kind of treatment. So this will include doing x-rays of the sinuses, and depending on what we find, we may recommend some form of surgical intervention.
So it's possible to totally cure sinusitis?
Yes, most absolutely. In terms of sinus surgery treatment, the technique we use nowadays is something called endoscopic sinus surgery. So no longer are we doing open surgery, cutting up the nose and sinuses to drain the sinuses. We are all doing the surgery through the nose using telescopes, using camera system, video system, and even computer guided system. Minimally invasive type of surgery to open up all the sinuses. And most of this surgery can be done as an outpatient procedure without the patient having really to stay overnight. So success rate for this has been very high in selected individuals. So we are now able to use balloon to dilate or to open up the passage to the sinuses. We have to remove less tissue. We can do opening of the sinuses at a remote distance. Say it's very useful for frontal sinus because the distance from the nose to the frontal sinus is very far away. So we can use this balloon, thread it up to the sinuses, blow up the balloon. That means it pushes the passage open, and then we can flush out all the mucus and all the infected material from the sinuses.
And can we prevent sinusitis?
So importantly, when you do have a flu and a cold, make sure you have it managed. Take care, drink lots of fluid, have your nose flushed out, take medicine to reduce the amount of mucus being stuck in your nose, and that typically will help you recover and prevent you from developing into sinusitis. Remember, if your symptoms last more than 10 days, you have a persistent problem, you don't have to live with this. Come to see a doctor and we can have it solved for you.
Thank you, Dr. Pang, for your time. I'm sure the audience will be very happy to have this information so they can manage their sinusitis better and get treatment as soon as possible. Thank you.
Thank you, Ira.